Orlando shooting renews debate over limits on gay men donating blood. In the aftermath of the Pulse nightclub shooting in Orlando, Florida, 53 people were alive but wounded, many in desperate need of blood. Blood banks in the area put out a call for donors. Gay men were ready to volunteer. Rumors even went around that blood centers in Orlando had relaxed a ban on donations from sexually active gay men. But the rumors were false. The ban, imposed by the Food and Drug Administration, remains in place, infuriating some gay rights activists. The agency does not permit a man who has had sex with another man in the past year to donate blood. Loosening that restriction, officials say, would greatly increase the chances of contaminating the blood supply with HIV and other sexually transmitted infections. Many gay rights activists have protested the rule, arguing that demanding a year's celibacy is unreasonable and that the ban perpetuates homophobic stigma. Mass murder in a gay nightclub has brought the debate to the fore. Kelsey Louis, the chief executive officer of GMHC, the Gay Men's Health Crisis, described the restriction as adding insult to this nightmare and called for a blood donation policy that is inclusive and based on science, not stigma. The FDA says its position is based on science and notes that its one-year waiting period is in line with policies in Britain and Australia. France dropped its ban on donations from gay men last year. The health authorities must balance the demand for blood against the inevitable consequences. Despite elaborate screening criteria and modern blood testing, FDA officials note, every year some of the 3.5 million patients who receive transfusions are infected with various diseases. For example, after the agency approved a test in 2007 for Chagas disease, which can be lethal, it found more than 5,000 donors with it, not all of them first-time donors. Even with current testing, the agency estimates that about one donation in 1.5 million transmits HIV to the recipient. Lifting the restriction on sexually active gay men would raise the risk of HIV infection to 1 per 375,000 donations, which the agency considers unacceptably high, Dr. Peter W. Marks, the deputy director of its Center for Biologics Evaluation and Research, said in December. Donation screening policies are based on a combination of trust in human nature and hard science, both of which are fallible.